Hi everyone, so today I want to talk about platelet-rich plasma, also known as PRP. Platelets are found in our blood along with white cells and red cells and plasma, and they have growth factors, and those growth factors can be used to help the body heal itself. Some people consider PRP an orthobiologic, or they'll lump it into the regenerative medicine category. It is not stem cells. The way we get platelets out of the blood is we draw blood out of your arm like we would for lab work, and then we spin it down in a special machine, and then we immediately re-inject that back into, say, a joint, a tendon, or a bursa. PRP was first used in maxillofacial surgery back in the early 1990s, and they found that it had anti-inflammatory properties, acted like a biological glue, and had some antimicrobial properties as well. And over time, we've started using it in the musculoskeletal world. Now, in Europe, it's been used for much longer than it has here in the United States. But we can use it to treat symptoms of osteoarthritis, as I said earlier, bursitis, and chronic tendinopathies like patellar tendinopathy or even tennis elbow. Now, not all platelet-rich plasma is created equal. So we think the optimal amount of platelets per milliliter of plasma is around 1 billion. And so depending on the location that we put the PRP, that will determine how much PRP we actually use, whether it's a joint, a tendon, or a bursa. Surgeons will sometimes use PRP intraoperatively where they will inject it into a joint, or even soak, for example, an ACL graft in PRP prior to doing a reconstruction.
Here's a still photo of a PRP injection under ultrasound guidance into a knee joint. You can see my needle coming in from the left side of the screen. And the beauty of using platelet-rich plasma instead of steroid is that the platelets will go into this joint and nourish the cartilage cells, also known as chondrocytes, that coat the bone in the joint. Now, while it doesn't regrow cartilage, it does improve the overall integrity of the joint and reduces inflammation. Studies have also shown that platelet-rich plasma tends to be more effective for a longer period of time than a steroid injection. For example, in a bursa, steroid injection usually lasts about 6 weeks and then starts to wear off, whereas platelet-rich plasma really starts to take off in terms of its efficacy around that 6-week mark and can last for several months thereafter.
PRP is often preferred to steroid because steroid can degrade cartilage and disrupts the collagen bonds that give a tendon its tensile strength. So we very infrequently inject steroid into joints anymore, and at least in our clinic, we never inject steroid into tendon sheaths because of the risk of rupture. If you're interested in learning more about PRP and how it might help you, or if you'd like to have an injection, give our office a call.